First News with Keeler in the morning on WIBX and WIBX950.com.
Here is Dr. Kent Hall from MVHS. He is the Chief Physician Executive. If you have any questions that we can squeeze in here before we head into the weekend, 315-736-0186. Dr. Hall, good morning.
Good morning. How are you doing this morning?
Good. Where do we stand on numbers there? They continue to be in a plateau situation?
Yeah, they are. So we're actually at the exact same spot. We continue to have 22 patients here at here within the system. So not really moving at all there.
You know, you have 22. Oneida County. This is only Oneida County residents, but the number of county residents hospitalized is down to 15, which, again, we can't seem to get out of November. That's the lowest number since November 1st.
Right.
If we go any lower, I think we do dip into October. But at least on that end of it, we're heading in the right direction.
Yeah, we are, and that's a really good thing. I really can't emphasize enough how stressful this has been for everybody in taking care of patients. Just as it's been, I know it's been stressful for everybody, but the staff at the hospitals, and I'm not just talking about Mohawk Valley Health System, just whether it's Rome or Oneida or Bassett or wherever, having to take care of really sick patients for extended periods of time, and a lot of them. It's really good to getting back to some sense of normalcy from a healthcare standpoint, which is good. So hopefully we can continue that.
Okay, let's talk about what's his name from Microsoft?
Gates, Bill Gates.
Bill Gates. I was going to say Steve Jobs. That would be, cause some rolling over in the grave for Steve Jobs. Bill Gates saying, and he's been really instrumental in funding research and doing whatever he can do from a technological side and from somebody who has a lot of money to combat this virus. And he believes, the end of 2022? We will not be back to normal until the end of 22. That's what he says. What do you think?
Yeah, so I think it depends on what you mean by normal. So if you mean normal like, the way we lived life in 2019 or 2018, then, I think sometime into 2022, early, middle, end, wherever that is, I think that's probably true. There are a lot of factors that you have to put into that. So first and foremost, I would say, we're not going to eradicate this virus. We're going to need to learn how to live with it. And so part of that is vaccines. Part of that is what the drug companies like Merck are doing in terms of developing medications that, hopefully that are pills that can be taken that at least in small trials so far have been shown to actually decrease the amount of virus. They haven't done anything, they haven't looked at it yet as it relates to sickness, but it certainly decreases the amount of virus that a person has within their body based on how they test. Those are things, but until we get a bunch of those, then we're still going to need to do the social distancing, potentially the masking, although we may not, certainly not as it exists now. With more people getting vaccinated, I think that we will be able to loosen that up a little bit. But I certainly can't say that we're going to be able to say, by the end of 2021 or whatever, we're going to be normal. But again, it depends on what your definition of normal is. You also agree with President Biden in saying that if we continue along the path that we're going from a vaccination standpoint, and we really get people who are right now a little concerned or skeptical about taking the vaccine, and we can get them to realize what the true benefits are and that the risks are minimal, then by the 4th of July we will be able to enjoy each other more, which is not to say that we're going to be normal like 2019, but we'll be able to enjoy each other more.
Yet earlier in the week, there was an editorial that was from Bloomberg that said we'll never get out of this.
So like I said, we're not going to eradicate this. This is not going to be like smallpox where it ceases to exist as a native infection. So we are going to need to learn to live with it. If we can get it down to, similar to what we do with the flu, or even better, if it turns out that the that the mutations and the variants that pop up are even less frequent than that, and maybe you don't need to take a vaccine every year. Maybe it's every 2 years or 5 years, or in a perfect world, like just once for your life.
Yeah.
Then that would be great. But to say that this virus is going to cease to exist, no. I truly believe. I would love to be wrong in this, but I truly believe that this virus is going to continue on forever.
Yeah.
So, Doc, somebody who's been fully vaccinated, like Andrew, like Bill's wife, they should prepare that once we go through all the age groups and everybody gets the vaccine, they got to get in line again, right, to get the next round of vaccine. I don't know, maybe by this winter, maybe early next spring.
So I think that it would be good for everybody to say that is a possibility and to live in the world where it's possible. Hopefully we won't need to do that, but I think it's better to have an expectation that we will need to do something and then find out we don't. I think that's better than thinking, oh, we're fine, and then be disappointed when it turns out that we have to.
So I guess I'm a little confused. If you say it's going to be here, like the flu is, like it comes back every year or it's around every year, what would be the way to prevent yourself in 2022 or 2024 if COVID-19 is still around? Would it be a pill that you take, or would it be getting another vaccination?
So it could be one, the other, or both. It depends on how we learn about how the vaccines do, how long they last, what we get from herd immunity, or as we approach herd immunity, and also how beneficial any pills that are developed are, both in terms of making people less sick if they do get sick, or potentially keeping people from getting sick.
I hate to say this, and I'm not saying it in a disrespectful way by any means, but you're speaking like a weatherman who's very careful about saying it could be windy and it could rain, but the sun could shine as well. Because I think there's so much that we are learning about this in real time. It becomes so difficult to say, well, here's what's going to happen, because we just don't know.
Yeah, and I appreciate that. I won't apologize for it, because I think you're right. I am, because I don't know, and I think if you ask Dr. Fauci, he wouldn't know either.
Yeah.
He knows a whole lot more than I do, but I don't think that he would say, "Oh, it's definitely going to be X or Y." And in fact, what I would say is, if you're listening to people who say it's definitely going to be, gone by whatever, you should be a little skeptical.
Anybody that has absolute in their statement is you're going to have to be, because I don't think on any side of this issue anybody really knows. Let me do Ray, and then one final follow-up question. Ray, you're on with Dr. Kent Hall.
Yeah, Dr. Kent Hall. My cousin just had a heart operation on March 3rd, and what is it now, the 25th, 26th? He said he still feels weak, and he had COVID, too, when he had the operation. Does he still have COVID?
So he's far enough out, he probably does not have COVID, no. But certainly the stress on your system, especially the double stress of having a major surgery and having COVID, probably it will take him a while to recover and get back to his level of stamina.
And Ray, I got to tell you, talk to anybody who's had COVID. There are so many out there that say months afterwards they're still having fatigue problems or pain or whatever. He feels weak, he tells me. Yeah.
And that from the operation, or he's got to recover, or what? It's been what, since the 3rd of March?
Yeah.
Yeah, recovering from heart surgery is not a short process. So, that's not surprising. And like I said, you add COVID to that, you could be talking, weeks, months. But following the regimen that the doctors prescribe in terms of rehabilitation, physical therapy, those kinds of things is really the best course.
Did he give him anything for COVID while he's out? Like, he takes a lot of pills, I know, after that. But
I would. I'm almost out of time, Ray. I hate to do this to you, but I would definitely recommend that he follow exactly what his doctor is telling him. And it's tough. You go through the heart surgery and COVID. Man, I can't imagine. But Ray, thank you. I got to let you go. And Dr. Hall, I was going to spring what do you think about the legalization of marijuana recreational? But we are out of time. Monday morning, I'm going to hit you with that question, though.
Sounds good. Everybody, have a great weekend, and please be safe.
You do the same. Thank you so much.